Hello, my name is Desiree Leapart, and I am a graduate student at George Mason University enrolled in HAP 671 Healthcare Databases taught by Dr. Alemi. In this presentation, I will present a predictive model for diabetes. According to the Centers for Disease Control and Prevention, about 10.5% of the United States population has diabetes. Additionally, 21.4% of diabetes cases are undiagnosed. And in 2017, diabetes was the 7th leading cause of death in the United States. Diabetes can have profound impacts on a person's health, and if undetected or uncontrolled, it can damage vital organs and tissues such as the heart and eyes. Diabetes type 2, which is the most common form of the disease, is often asymptomatic in early stages and can remain undiagnosed for years. The data used for this model is simulated data from a major healthcare institution in the United States. There are 17,443,442 unique records in the database and 829,827 unique patients. Clinically, diabetes is a disease that occurs when blood glucose levels are too high. High glucose levels can be a result of many factors. Here you will also see how diabetes was defined in the database. ICD-9 codes considered a diagnosis for diabetes were specified. A comprehensive set of diagnoses were used to predict the presence of diabetes. There were 3,383 conditions with at least 29 cases. In addition to disease as a predictor, age can also be a predictor, with adults in their 50s and 60s being at highest risk. These are examples of obvious predictors of diabetes. These are diagnoses that always occur with diabetes or have diabetes in the name. They were not used in the definition of diabetes, but were kept in the model for computational accuracy and to help adjust for situations in which key information is missing in the medical record. These are examples of rare conditions in the database. These are conditions that occurred 30 times or more in the data but have much less occurrence than other conditions. It is important that these conditions remain in the model because the combined effect of these rare conditions can impact predictions. These are the top 10 most predictive diagnoses in the model. These diagnoses exclude obvious predictors and are most predictive for diabetes. Their likelihood ratios were highly associated with diabetes. The naive Bayes formula was used to predict the likelihood of diabetes. With this formula, we can aggregate multiple likelihood ratios to determine if a likelihood ratio for each diagnosis. Here is a patient example using naive Bayes formula. This patient had 5 diagnoses, which are shown here. Using the naive Bayes formula, one can calculate the likelihood ratio of each diagnosis for the patient and determine the overall odds of diabetes. Data was set aside in this model for cross-validation. The data was first cleaned to remove duplicates or other errors in the database. Once cleaned, 80% of the data was randomly set aside as the training set to estimate likelihood ratios, while 20% of the data was set aside for the validation set. The calculations for this model were performed on the validation set. Predictors that occurred after diabetes were not considered in the validation set for accuracy of making predictions and not detecting those who already have diabetes. A receiver operating characteristic curve is used to plot the rate of true positives against the rate of false positives. In other words, this shows the sensitivity and specificity for a test at all possible cutoffs. Sensitivity is the true positive rate, while 1 minus specificity represents the false positive rate. The area under the curve represents the accuracy of the model. Here, the area under the curve is approximately 0.9, meaning that the model is about 90% accurate. The closer the area of the curve is to 1, the more accurate the model is. Although the model presented is about 90% accurate, there is still room for improvement. Using a predictive model can be used to screen for diabetes. Critical prediction models are useful for screening high-risk individuals for asymptomatic disease, to predict future events of disease or death, and to assist medical decision-making. According to a 2016 study by Young-Ho Lee et al., many models have been developed to screen for undiagnosed conditions, but few have been used on the external population. The next step, after developing the model and rigorous testing with multiple external data sets, is to disseminate the model to be used in practice. Thank you for watching this presentation.